There have been over 1,000 well-documented studies that have shown that physical activity has a positive impact on our mental health, both in preventing us from developing common mental health conditions such as depression and anxiety, but also as part of treatments for those and other mental health conditions. How that happens is thought to be a mixture of factors, including biological mechanisms, psychological factors, and social factors. So if you think about the biological factors, when we exercise, our brain releases certain chemicals and neurotransmitters. We often hear about getting an endorphin rush, but it's not just as simple as that. We also get increased serotonin levels, increased dopamine levels when we exercise. As clinicians, some of us may be focused more on medication, some of us more on psychological therapies. So it's keeping it at the forefront of our minds that it is a really useful tool that we have, that we can help patients as part of their treatment plans. The second thing is obviously talking to our patients about it and being mindful how we do that. If we just say, right, everyone needs to exercise more, go for a run, it needs to be 45 minutes, that might not be realistic and might be seen as teaching and actually put people off. So really get to know your patient, start the conversations, think about how they could gradually introduce more physical activities. It might not be what we conventionally think about exercise. It might be as part of their household, things they do at home, childcare, running around after children. That's also physical activity. So really start those conversations. We are increasingly using Dialogue Plus, which is a helpful tool in introducing those conversations. There's questions in that about how satisfied people are with their physical health and leisure. So perfect opportunities to start talking and thinking about exercise.